Hi everyone, welcome back. As I mentioned in my last lecture, though, on bones and skeletal tissue, what we're going to do now is start to move forward with dissecting the human skeleton. We'll do it one bone at a time, looking at all the features and their parts. To get us started, let's take a look here at a short animation.
The skeletal system consists of approximately 206 bones, providing the body with structure and support. Let's take a tour of various components that form the skeletal system. Here's the skull. It has 8 cranial bones that protect the brain. The facial skeleton has 14 bones that provide a framework for the eye sockets, jaws, and teeth. The facial bones provide the framework for the various structures of the face, including the overlying muscles, fat, and skin. The vertebral column is composed of 24 individual vertebrae, along with 2 sets of fused bones called the sacrum and coccyx. In addition to providing support for the trunk of the body, the vertebral column protects the spinal cord. Altogether, there are 7 cervical or neck vertebrae, 12 thoracic or upper back vertebrae, and 5 lumbar or lower back vertebrae. The sacrum is composed of 5 fused bones, while the coccyx, or tailbone, is typically made up of 3 to 5 bones. 12 pairs of ribs form a protective cage for the heart, lungs, and other internal organs. The first 7 ribs are called true ribs because they attach to the breastbone or sternum. Ribs 8 through 12 are called false ribs because they either attach indirectly, or as in the case with ribs 11 and 12, float and don't attach to the sternum at all. Now, let's take a look at the pair of shoulder blades, or scapulae, and the collarbones, or clavicles. It is very important for the scapulae to be mobile because they connect to the shoulder joint, which is the most movable joint in the body. The bones of the upper limb include the humerus, which connects the shoulder with the elbow, the ulna, the radius, the wrist bones, or carpals, the hand bones, or metacarpals, and the finger bones, or phalanges. To complete our tour, let's take a look at the pelvic girdle, knee, and foot. The pelvic girdle is formed by a pair of hip bones. Each hip bone is comprised of 3 fused bones, the ilium, ischium, and pubis. The pelvic girdle connects with the femur or thigh bone at the hip joint. The femur is the longest bone in the body and is important for bearing the body's weight while standing. At the knee, the femur articulates with the tibia or shin bone. The fibula does not bear weight, but several muscles attach to it. The patella or kneecap is suspended within muscle tendons and glides over the femur and tibia when the knee bends. And last, but certainly not the least, are the feet. The foot bones, which include the tarsals, metatarsals, and phalanges, are organized into a series of arches that allow the feet to support the body's weight.
All right, that takes care of the skeleton. We'll see you in a week. Now, just kidding. Actually, pretty good overview, though, although we will obviously be going in more detail. What you see in front of you, though, on the screen, those page 67 out of your lecture notes, it's just an overview of kind of the approach we're going to take here to study the skeleton. As we learned last time, the skeleton can be divided into 2 parts, the axial skeleton and appendicular skeleton, and that's the approach we'll take. We'll look at the axial skeleton first, and then the appendicular skeleton. Just by way of review, though, remember the axial skeleton is made up of 3 different parts: the skull, the vertebral column, and the thoracic cage. It forms what we call the longitudinal axis of the body, involved primarily in support and protection. The skull supports and protects the brain. The vertebral column supports the weight of the torso, protecting the spinal cord on the inside, and the thoracic cage supports the chest wall and protects the heart and the lungs on the inside of it. The appendicular skeleton is made up of the upper and lower extremities and the pectoral and pelvic girdle. Whereas again, the axial skeleton is involved primarily in support and protection, the appendicular skeleton is primarily involved in movement. Well, that's all I have for you for now. I'll be in touch again soon. Otherwise, though, enjoy the rest of your day. Thank you very much.